The Trump administration began terminating thousands of staff and purging some of the top leaders today at the Department of Health and Human Services. That included several key agencies, including the FDA, the CDC, and the National Institutes of Health.
Hundreds of HHS employees waited in line this morning, some for as long as an hour, to get into the building and find out if they still had a job. Between layoffs and buyouts, HHS Secretary Robert F. Kennedy Jr. says he plans to fire about 20,000 workers.
Hello, I'm Dr. Haydee Brown.
And I'm Dr. Sonya Sloan.
And we are eh-yah,
Black and brown women disruptors in healthcare and beyond. So there's been significant developments. This will basically change the landscape of public health in the country as we know it. The Trump administration has initiated mass layoffs across 3 critical federal health agencies, the CDC, NIH, and the FDA. And according to multiple reports this week, that's approximately 10,000 federal employees that are being cut from these agencies. And you guys, these aren't just administrative staff people. We're talking about epidemiologists, researchers, public health coordinators, and regulatory personnel. So these are important people that we need. So the stated objective per our health security, Robert F. Kennedy Jr., is to reduce bureaucratic bloat and improve efficiency from federal system. But Kennedy also went on to say this week in most of the reports that these cuts will happen, and they didn't mean to make them happen. But he stated that, beginning with this unofficial Department of Government Efficiency, we know as DOGE now, we'll be cutting 80%. But 20% of those people will be reinstated because it was a mistake. So, excuse me, but we're cutting but not being efficient, if you will. So how these scientists and healthcare professionals think about this, we think they're going crazy. This is like, using mass chaos and confusion and then trying to go back and fix it on top of all the lawsuits. Let's roll this clip.
Dr. Frieden, 20,000 in cuts from Health and Human Services is undoubtedly more than you would think is wise. But 0 cuts is probably not the right standard either. So where should the efficiency at the HHS land?
The administration seems to be starting with a goal of reducing large numbers of staff, but when you look at what those staff are doing, they're protecting Americans. This is a recipe for disaster. It's not going to make us healthier. It'll make us sicker. It'll increase healthcare costs for families, for communities, and for the country.
We stand with CDC Director Tom Frieden when he says this is a disaster, not some aha moment about making America healthy again. In fact, these reckless budget cuts will cost millions of lives, both in the short and long term, all to appease the Doge crowd and save a few bucks. Every time I say Doge, I keep thinking about these kids with backpacks on that are still in college. The impact of these cuts is devastating. At the FDA, slashing personnel will delay drug approvals and medical device regulations, meaning life-saving treatments will take longer to reach our patients, and there will be fewer safety checks on products that do not make the market or that finally make the market. And these budget cuts to the FDA, they also put our food safety at risk by slashing inspections, slowing down critical research, and making it harder to monitor imports, all while overloading staff. These cuts will ultimately weaken the agency's abilities to protect the food, to protect the public from unsafe food, leaving us more vulnerable to contamination and outbreaks. Then, at the CDC, the impact is potentially more alarming. This agency plays a pivotal role in outbreak surveillance, vaccine distribution, and emergency response coordination. Cutting staff weakens our national readiness for public health threats, whether that's the flu, or COVID, or measles, or future pandemics. 5 years ago, right here in New York City, we were losing about 800 people a day to COVID. That was with properly funded and staffed CDC and local health support. Now with these cuts, just imagine the devastation we could face when another crisis hits. Will we even know we're in a health crisis without a properly funded and staffed CDC, NIH, and other essential federal agencies to lead the way? And let's not forget the NIH, right? With fewer researchers and grant administrators, we're looking at a serious slowdown in medical research, especially for chronic conditions that disproportionately affect minority communities. That's your hypertension, diabetes, cancer, sickle cell disease, and more. And the NIH doesn't just fund research at its own locations. They provide crucial grants to scientific research at the majority of major institutions across the country. So it's not just science that gets delayed here, guys. It's not just science. It's real progress that could save lives. So instead of making America healthy again, this administration is making America sick again without the ability to respond when the next crisis strikes. Let's go to a clip.
I don't think they fully understand what they are done. Look, bad stuff is going to happen on their watch that they're going to have to deal with. And they're not going to be equipped to do that. That's what's going to happen. But we have to be careful, though. This is not just about FDA, or NIH or CDC. I mean, you see what's going on in the universities. We have to be very careful. I mean, the thing that has made, America great, that it's made America competitive, there's a lot of things. But the biomedical infrastructure, right? The advances, the reason we are able to live long and productive lives, right? Are because of the investment, not because we're smarter today, but because the investment we made 50, 75 years ago, and that's being destroyed. And it's across the board. We have to rescind these cuts. Enough is enough.
So there you have it from David Kessler. He's talking about human lives, American lives. And this isn't happening just in isolation. All of these things, these cuts, the budget, just for the sake of money. These are things that are following other controversial moves, such as the recent freeze on Title X family planning funds and efforts to roll back reproductive health support and our rights as women. We're witnessing, you guys, the structural dismantling of public health and the infrastructure under the guise of administrative reform. And it sucks. And a lot of us really are pointing fingers, but I think it's very interesting that we have now put at the helm Secretary Kennedy Jr. as a long public record of espousing anti-vaccines and views and challenging our established scientific consensus. But he is a critic. And I mean, he's been criticized even by his own family, my God. And according to his beliefs, now him being at the helm are not just counterproductive. You guys, it is destroying America and it's downright dangerous. So here's what the public should know. The layoffs are already in motion. I mean, cat's out the bag. We can't do much right now. The lawsuits are unfolding as we know it. The oversight, research, and response time is going to be significantly impacted. I mean, we cannot move quickly enough to get research out there. It takes years, you guys, to plan and do this type of stuff, as well as the vulnerable communities out there, particularly the low-income, under-resourced population. And I'm talking about African Americans, Latinos, Hispanics, Asians. They stand to lose the most from this reduction in public health capacity. Dr. Brown?
As physicians, we're trained to look at data and outcomes. This decision, it's not data-driven. It's ideologically driven. And the outcome? Reduced access to care, weaker preventative health systems, and stalled research innovation. So for our listeners, especially those in medicine, public health, and public health policy, stay informed, engage with organizations fighting for federal health infrastructure, make your voice heard through professional associations, local representatives, and at the ballot box. The recent election in Wisconsin shows us that there is power in the ballot box, and use trusted sources. Sadly, the CDC, NIH, and other federal bodies can't be counted on anymore. So turn to organizations like the American Medical Association or the American Academy of Pediatrics and others leading the charge. You guys, this is not about politics. This is not about MAGA. This is not about MAHA. It's about public safety and the long-term health of our country. We don't have reliable care if we don't have strong institutions. Punto. Period. So thank you for watching. We are eh-yah, contributors to the MeidasTouch network and proud members of the Meidas Mighty.
So subscribe, like, share, and follow for more updates. Have a great week.
Bye, everyone.
Love this video? Make sure you stay up to date on the latest breaking news and all things Meidas by signing up to the MeidasTouch newsletter at MeidasTouch.com/newsletter.